It can be incredibly frustrating, can't it? When something that used to feel natural and easy suddenly becomes a struggle, or worse, just doesn't happen at all. We talk about staying active, eating right, keeping our minds sharp as we get older, and all of that is vital, absolutely vital. But there are other aspects of life, deeply personal ones, that can also change, and they don't always get discussed openly. And when those changes involve intimacy, well, it can hit hard. It can affect how you feel about yourself, how you connect with a partner. It can just add a heavy weight to everyday life. Many men, as they navigate the years past 60, might find that getting or keeping a strong erection isn't as simple as it used to be. And often, the immediate thought goes to age itself, or maybe underlying health conditions like heart disease or diabetes, which are certainly common culprits. But sometimes, the very things we do to stay healthy in other ways might be having an unintended effect. What if something you're taking, prescribed by your doctor to help you, is actually making things worse in the bedroom? It's a painful reality to consider that the medications designed to improve your health could be silently interfering with your sexual function. It's like a hidden secret, something you might not even think to ask about, or perhaps feel uncomfortable bringing up. In this video, we're going to look at 5 common types of medications, ones that many men over 60 take every single day, that could be unintentionally killing your erection without you even realizing it. We'll discuss why they might have this effect and, most importantly, what you can do about it by talking to your doctor. Understanding this is the first step, and it's a powerful one. Stick with me until the very end, because we'll cover something that might genuinely surprise you about taking control of this situation. Let's dive right in and start with the first type of medication that could be impacting your erections. And it's one that a huge number of people over 60 are taking, often for very good reasons related to heart health. I'm talking about medications used to treat high blood pressure. High blood pressure, or hypertension, is a major risk factor for serious health problems like heart attacks and strokes, so taking medication for it is incredibly important for your overall health and longevity. Doctors prescribe various types of medications to lower blood pressure, and while they are effective at their primary job, some of them can, as an unwelcome side effect, make it difficult to achieve or maintain an erection. Think about how an erection happens. It requires a healthy flow of blood into the penis. When you're aroused, blood vessels leading to the penis relax and widen, allowing blood to rush in and create firmness. Medications that affect blood pressure work by influencing the cardiovascular system in different ways, and sometimes these effects can interfere with that crucial blood flow or the nerve signals involved in arousal and erection. Let's talk about some specific types of blood pressure medications. Diuretics, for instance, often called water pills, help your body get rid of excess salt and water, which lowers blood pressure by reducing the volume of fluid in your blood vessels. While effective, some diuretics, particularly thiazide diuretics, can sometimes affect blood flow or electrolyte balance in a way that makes erections more difficult for some men. It's not guaranteed, and many men on diuretics have no issues, but it is a known potential side effect. Imagine your body carefully balancing fluids and pressures, sometimes altering that balance, even for a good reason like lowering blood pressure, can have ripple effects elsewhere, including the delicate hydraulic system needed for an erection. Then there are beta blockers. These medications are often prescribed for high blood pressure, but also for heart conditions like angina or irregular heartbeats. Beta blockers work by blocking the effects of adrenaline and noradrenaline, which slows your heart rate and reduces the force with which your heart pumps blood, thus lowering blood pressure. While this is great for your heart, these same chemical messengers, adrenaline and noradrenaline, also play a role in the body's arousal response and nerve signals that contribute to erections. By blocking these signals, beta blockers can sometimes dampen the body's ability to initiate or sustain an erection. It's like turning down the volume on a system that needs certain signals to operate optimally. It's a significant class of drug, and a common reason for erectile difficulties that might be linked to medication. Another type of blood pressure medication is calcium channel blockers. These work by blocking calcium from entering muscle cells in the heart and blood vessel walls, which relaxes the blood vessels and reduces the heart's workload, leading to lower blood pressure. Generally, calcium channel blockers are considered to have a lower risk of causing erectile dysfunction compared to some other blood pressure medications, but it's not zero. Individual responses vary greatly. ACE inhibitors and ARBs, angiotensin receptor blockers, are two other very common types of blood pressure medications. These work on a specific hormonal system that regulates blood pressure. They are often considered less likely to cause erectile dysfunction than beta blockers or some diuretics, but again, it's not impossible. Some men might still experience issues. The body is a complex network of systems, and affecting one pathway, even a major one like the renin-angiotensin system, can have downstream effects. Now, the crucial takeaway here is not to panic, or absolutely not, to stop taking your blood pressure medication. High blood pressure is a serious health issue that needs to be managed. The purpose of knowing this is to be informed and empowered. If you're taking medication for high blood pressure and you've noticed problems with erections, it is incredibly important to have an open conversation with your doctor. They might be able to switch you to a different class of blood pressure medication that is less likely to cause this side effect. For example, some doctors might prefer to try ACE inhibitors or ARBs first if erectile dysfunction is a concern, because they are generally associated with a lower risk. Or they might adjust the dosage. Sometimes a lower dose is sufficient to control blood pressure and might have fewer side effects. Your doctor is the expert who can weigh the benefits of your current medication against the potential side effects and discuss alternatives. They might also explore whether other factors are contributing to the erectile issues. Remember, age, diabetes, heart disease, cholesterol levels, smoking, alcohol intake, stress, and psychological factors can all play a role. It's rarely just one thing. But if you're on a blood pressure medication, particularly a beta blocker or certain diuretics, and experiencing problems, it's definitely worth mentioning to your doctor as a potential link. Don't assume it's just age. It could be something that can be managed with a simple change in prescription, guided by your doctor. This awareness is key. Now that we've covered how blood pressure medications can sometimes play a role, let's move on to another group of medications that are very widely used, particularly as people get older and face the emotional ups and downs that life can bring. And these too can have a significant impact on sexual function, without many people realizing it. Continuing our discussion, let's turn our attention to another extremely common group of medications, especially prevalent among the 60-plus age group, that can significantly impact sexual function, including the ability to get and keep an erection. These are medications prescribed for mental health conditions, specifically antidepressants and anti-anxiety medications. Dealing with depression or anxiety is challenging enough on its own, and these medications can be lifesavers for many people, helping to lift mood, reduce worry, and improve overall quality of life. However, it's well documented that many of these medications, particularly a class of antidepressants called selective serotonin reuptake inhibitors, or SSRIs, can cause sexual side effects, including decreased libido, sex drive, difficulty achieving orgasm, and yes, erectile dysfunction. SSRIs work by increasing the levels of serotonin in the brain. Serotonin is a neurotransmitter that plays a key role in regulating mood. but it also affects other bodily functions, including those involved in sexual response. By altering serotonin levels, these medications can dampen the signals in the brain and nervous system that are necessary for sexual arousal and physical response, like achieving an erection. It's a complex interaction, and while the primary goal is to improve mental well-being, there can be this unintended consequence. Other types of antidepressants like SNRIs, serotonin norepinephrine reuptake inhibitors, and older classes like TCAs, tricyclic antidepressants, can also cause sexual side effects, often through slightly different mechanisms affecting various neurotransmitters. Even some anti-anxiety medications, particularly benzodiazepines, can sometimes affect libido and function, although this is generally less common than with many antidepressants. The painful reality here is that someone might be feeling better emotionally thanks to their medication, which is wonderful, but then face new frustration and distress because of the impact on their sexual intimacy. This can create a difficult situation, potentially affecting relationships and self-esteem. And often people feel awkward or embarrassed to bring this up with their doctor, or they might not even connect the dots between the medication and the sexual issue. They might just attribute it to getting older or other health problems. It's crucial to understand that if you are taking an antidepressant or anti-anxiety medication and experiencing difficulties with erections, this is a known potential side effect, and you are not alone. Just like with blood pressure medications, the absolute worst thing you could do is abruptly stop taking your mental health medication. These drugs need to be tapered off under medical supervision, and stopping suddenly can lead to withdrawal symptoms or a relapse in your mental health condition, which could be far more debilitating than the sexual side effect. The course of action is, once again, to talk openly and honestly with your doctor. Don't feel embarrassed. Healthcare professionals understand that sexual health is an important part of overall well-being, especially in long-term relationships. They deal with these issues all the time. There are several strategies your doctor might consider. They might suggest switching you to a different antidepressant or anti-anxiety medication that is less likely to cause sexual side effects. For instance, some antidepressants like bupropion are known to have a lower incidence of these issues compared to SSRIs, or they might suggest adding another medication to counteract the sexual side effect. Sometimes a medication like sildenafil or tadalafil, commonly known by brand names like Viagra or Cialis, can be taken to help with erections, even while continuing the mental health medication. In some cases, adjusting the dosage might help, or your doctor might explore non-pharmacological strategies for managing your mental health. The key is communication. If you're feeling better emotionally but struggling sexually, tell your doctor. Explain what you're experiencing and how it's affecting you. They can help you explore options to manage both your mental health and your sexual health effectively. Sometimes it's a matter of finding the right balance or the right combination of treatments. Don't suffer in silence or make assumptions. Your doctor wants to help you live your best life, and that includes addressing side effects that impact your quality of life. Being proactive in discussing this is essential. Moving on from mental health medications, let's look at a group of drugs commonly used to manage a very prevalent condition in older men, one related to the prostate. Let's continue our exploration of common medications that could be silently affecting erections. This next category is highly relevant to men as they age, as it involves medications often prescribed for prostate conditions. As men get older, it's common for the prostate gland to enlarge, a condition known as benign prostatic hyperplasia, or BPH. An enlarged prostate can cause bothersome urinary symptoms, like needing to urinate frequently, having a weak stream, or feeling like you can't empty your bladder completely. To manage these symptoms, doctors often prescribe medications. Two main types of medications are frequently used for BPH, and they can sometimes have unintended effects on sexual function. The first type is alpha blockers. These medications work by relaxing the muscles in the prostate and the neck of the bladder, which makes it easier for urine to flow. While very effective at improving urinary symptoms, alpha blockers can also relax smooth muscle elsewhere in the body, including the muscles involved in ejaculation. For some men, this can lead to a condition called retrograde ejaculation, where semen goes backward into the bladder during orgasm instead of coming out. While not harmful, it can be alarming and affect the sensation of orgasm. Less commonly, some alpha blockers might also contribute to erectile difficulties for some individuals. It's not as common as with some blood pressure or mental health medications, but it's a possibility to be aware of, particularly if you started experiencing erection issues around the same time you began taking an alpha blocker for BPH. Think of these medications as loosening things up to help urine flow, but sometimes that loosening can extend to other areas involved in the male sexual response cycle. The second type of medication for BPH that can impact sexual function is 5-alpha reductase inhibitors. Medications like finasteride and dutasteride fall into this category. These drugs work by blocking the action of an enzyme that converts testosterone into dihydrotestosterone, DHT. DHT is a hormone that plays a role in prostate growth, so reducing its levels can help shrink the prostate and improve urinary symptoms. However, DHT and testosterone are crucial male hormones that also play a significant role in libido and erectile function. By lowering DHT and sometimes having a knock-on effect on testosterone levels, these medications can potentially decrease sex drive and make it more difficult to achieve or maintain an erection. This is a more direct hormonal effect compared to some other medications we've discussed. For a man dealing with uncomfortable urinary symptoms from an enlarged prostate, finding relief is important, but if that relief comes at the cost of a significant decline in sexual interest or function, it can be a very difficult trade-off. Again, it doesn't happen to everyone, but it is a well-established potential side effect of 5-alpha reductase inhibitors. Just as before, the message is clear. Do not stop your prostate medication without talking to your doctor. BPH symptoms can worsen without treatment, significantly impacting your quality of life, and in some cases, lead to complications. If you are taking an alpha blocker, or a 5-alpha reductase inhibitor for BPH, and you're experiencing problems with erections or sex drive, have that conversation with your urologist or general practitioner. They can help you determine if the medication is the likely cause. If it is, they might explore alternative treatments for your BPH. Sometimes, a different alpha blocker might be better tolerated. For men on 5-alpha reductase inhibitors, the doctor might discuss the possibility of reducing the dose, though this might also reduce its effectiveness on the prostate. Or, again, consider adding a medication specifically for erectile dysfunction, like sildenafil or tadalafil, to help counteract the effect. They might also evaluate your testosterone levels, as these can naturally decline with age, and contribute to both BPH symptoms and sexual dysfunction. It's about managing your BPH symptoms effectively, while also addressing the impact on your sexual health. Openly discussing side effects, even sensitive ones like this, is crucial for getting the best possible care and finding a treatment plan that works for your overall well-being. Don't assume that sexual side effects are just something you have to live with because you're treating another condition. There are often ways to manage or mitigate these issues with your doctor's guidance. Your quality of life, including your sexual health, matters. Next up, we'll look at another group of medications that might be surprising to some, but which are very commonly used for chronic pain and inflammation, and how they can sometimes indirectly or directly affect erections. Continuing our important conversation about medications and their potential impact on erections, let's explore a category that might not immediately come to mind for some people, but includes drugs widely used, especially by older adults dealing with chronic pain, inflammation, or heart conditions. I'm talking about certain medications used for pain relief, specifically opioids, and also, surprisingly, some medications related to managing cholesterol. First, let's address opioid pain medications. These are powerful drugs often prescribed for moderate to severe chronic pain, perhaps after surgery, for conditions like severe arthritis or certain types of nerve pain. While they are effective at reducing pain by affecting how the brain perceives pain signals, they also have significant effects on the body's hormonal system. Long-term use of opioid pain medications, even at moderate doses, can suppress the production of testosterone in men. Testosterone, as we discussed earlier in the context of prostate medications, is a key hormone for libido and erectile function. Lower testosterone levels can lead to decreased sex drive, fatigue, and difficulty achieving or maintaining erections. This can be a particularly tough situation, as someone relying on opioids to manage chronic pain is already dealing with a significant health challenge. Adding sexual dysfunction on top of that can feel overwhelming, and often the connection between the pain medication and the sexual issues isn't immediately obvious to the patient. They might just think their pain or age is causing the problem. If you are taking opioid pain medication long-term and are experiencing problems with erections or sex drive, it is vital to discuss this with the doctor who is managing your pain. They can evaluate your testosterone levels through a simple blood test. If your testosterone is low and linked to the opioid use, they might explore several options. This could include trying to reduce the dose of the opioid if possible, switching to a different type of pain management that doesn't affect hormones as much, or, in some cases, discussing testosterone replacement therapy to bring your levels back into a normal range, which might help restore sexual function and libido. However, testosterone therapy has its own risks and considerations, so this must be carefully evaluated by your doctor. The goal is to manage your pain effectively while minimizing detrimental side effects, including hormonal ones that affect sexual health. Open communication about all your symptoms, including sexual ones, is crucial for your doctor to provide comprehensive care. Now let's talk about something perhaps more surprising. Medications used to lower cholesterol, particularly statins. Statins are incredibly common, prescribed to millions of people to lower LDL cholesterol, bad cholesterol, and reduce the risk of heart attacks and strokes. They work by blocking an enzyme the body needs to make cholesterol. For the vast majority of men, statins do not cause erectile dysfunction, and in fact, by improving overall cardiovascular health and blood flow, some studies suggest statins might actually improve erectile function for certain individuals whose issues are related to poor blood flow caused by high cholesterol. However, there is a small subset of men who, after starting statins, report experiencing erectile difficulties. The exact mechanism isn't fully understood, but one theory is that because the body needs cholesterol to produce sex hormones like testosterone, significantly lowering cholesterol levels with statins might, in rare cases for some sensitive individuals, slightly impact hormone production, or perhaps affect nerve signaling or muscle function in ways that interfere with erection. It's important to stress again that this is not a common side effect, and the cardiovascular benefits of statins far outweigh this potential risk for most people. But if you started a statin and then noticed erection problems and other potential causes have been ruled out, it is something worth mentioning to your doctor. Your doctor might consider if the timing suggests a link. They might check your cholesterol levels to ensure the dose is appropriate. In very rare cases, they might consider trying a different type of statin or a different class of cholesterol-lowering medication, always balancing the need to manage your cholesterol and protect your heart against potential side effects. Remember, improving cardiovascular health is fundamental to good erections in the long run, as erections rely heavily on healthy blood flow. So, while statins are generally beneficial for erectile health by improving blood flow, it's worth being aware of this uncommon potential link and discussing it if the timing seems suspicious in your own experience. By understanding that opioids can affect hormones and, in rare cases, statins might play a role, you add more tools to your understanding of factors that could be impacting your sexual health. It's all about being informed so you can have productive conversations with your healthcare team. We've covered quite a bit: blood pressure medications, mental health medications, prostate medications, pain medications, and even cholesterol medications. These are just 5 common categories, but they illustrate a broader point. The medications we take, even for critical health reasons, can have complex effects on our bodies, including our sexual function. It's easy to feel discouraged or resigned if you're experiencing difficulties with erections. You might think it's an inevitable part of getting older, or just another problem to add to the list. But the most important takeaway from our conversation today is this: don't assume it's just age, and don't suffer in silence. Your medications are powerful tools for managing your health, but sometimes those tools need fine-tuning, or a different tool might be better suited for you, considering all aspects of your well-being, including your sexual health. Remember the medications we discussed. Certain blood pressure medications, especially beta blockers and some diuretics. Many antidepressants and anti-anxiety drugs, particularly SSRIs. Medications for an enlarged prostate, including 5-alpha reductase inhibitors like finasteride and dutasteride, and to a lesser extent, alpha blockers. Long-term opioid pain medications, and in rare instances, statins. If you are taking any of these types of medications and have noticed changes in your ability to get or maintain an erection, or a decrease in your sex drive, please make an appointment to talk to your doctor. Write down the medications you are taking and the specific issues you are experiencing. Be open and honest. This isn't a trivial concern. It's about your quality of life, your intimacy, and your overall sense of self. Your doctor is there to help you, and they are the best person to evaluate whether your medication might be playing a role and what alternatives or strategies are available. They might adjust your dosage, switch you to a different medication within the same class, or try a different class of medication altogether that has fewer sexual side effects. They might also investigate other potential causes, like underlying health conditions you might not be aware of, or lifestyle factors. And they might discuss treatment options specifically for erectile dysfunction, such as oral medications like sildenafil or tadalafil, which can often be safely taken even if you need to continue a medication that is causing issues. The surprise I mentioned at the beginning? It's not a magic pill or a secret ingredient. The surprise is how much simply having an open, frank conversation with your doctor can change things. Many men endure this issue silently for years, feeling embarrassed or defeated, when a discussion with a healthcare professional could lead to a relatively simple solution or a much better management plan. The power is in speaking up. Don't let a treatable side effect impact your life unnecessarily. Making small changes, asking the right questions, and being proactive about your health can make a profound difference, not just in managing specific conditions, but in enhancing your overall happiness and well-being. You deserve to enjoy all aspects of life, including intimacy, at any age. Thank you for watching. I hope this information has been helpful and empowering. If you found this video valuable, please give it a like. That tells us we're covering topics that matter to you. Share your thoughts or experiences in the comments below. Hearing from you helps build a supportive community. And if you haven't already, please subscribe to the channel for more videos like this, offering practical insights and encouragement for living well through your 60s, 70s, and beyond. Remember, you have the power to advocate for your health and quality of life. Live your best life at every age.